Hi everyone, thank you for coming with your busy day. I really appreciate it. I'm Rebecca Weingarten, and I'm a master's student at the University of Pennsylvania studying social policy and data analytics. This summer I'm with Central Staff, but we're doing my project between Central Staff and HHS. My research today is focused on examining the possible expansion to school-based health centers in Montgomery County. School-based health centers are located in schools or on school property and provide on-site comprehensive preventative health care, primary health services, and health education. The purpose of this assessment is to look at 4 of the SBHs within the county high schools in conjunction with assessing the county's disease burden for 7 specified diseases and areas of concern, which were outlined earlier by Dr. Gales in his presentation, to determine the site suitability of one of the 4 high schools to pilot a new extended and weekend hours program. These extended hours would allow for care to be provided not only to high school students, but to their parents, siblings, grandparents, and anyone in their household. These services would continue to be provided by HHS staff, and the site would be equipped with a variety of practitioners, being nurses, nursing assistants, site coordinators, as well as mental health counselors. The SBHCs that we are considering for this program, there are 13 overall in Montgomery County, 4 of which we're looking at, which are within high schools. Those are Watkins Mill High School, Gaithersburg High School, Wheaton High School, Northwood High School, and we are considering these for the extended hours. Although Montgomery County is relatively healthy, as you heard already, there's always room for improvement. Piloting an evening hour and weekend program would allow for us to increase access and education around some of the health concerns facing the county for students and for their families. The data sources for this project are Health in Montgomery County 2016 report, which you saw a little bit of earlier, the U.S. Census data, HHS Montgomery County hospitalization data, and CHIP County mortality data. The 7 diseases I am analyzing are STI prevalence, heart disease, suicide, substance abuse, chronic lower respiratory disease, teenage pregnancy, and diabetes. The SBHCs would be able to continue providing all services to school students as well as care for their families. For this reason, I have decided to include diseases such as heart disease and CLDR, as they are affecting an older population, not just high school students. Here is an example of one of the 7 diseases I'm looking at as mapped across the county by a high school cluster. You can see that the STI rate in Montgomery County, the STI rate, particularly for chlamydia and gonorrhea, has increased over time, and we see the highest rates in Gaithersburg and Watkins Mill, which we see over here. Sorry, Jenna. To create an aggregate score and rank which school should be pilot the program, I created 2 scenarios, with STIs, which is here on the left, and on the right you see without STIs. The reasoning for the 2 different versions of looking at this is because the rate of STI drastically changes the overall score and really questions our methodologies and target populations for for the services that should be provided by the school-based health centers. Based upon the all disease aggregate and the disease aggregate minus STI, there are 3 choices that I've drawn up. Choice 1, if considering all diseases, then the choice is between Wheaton and Watkins Mill. Choice 2, if considering diseases minus STI, then the choice is clearly Wheaton. However, it draws into question what Dr. Gale said earlier and the continued concern over substance abuse and suicide. This is an SBHC that's already in a high school, so we should continue to be concerned about the increasing rates of each of those issues, so perhaps we should be looking at Up County. So finally, in order to finalize my recommendation, I will continue to look at the 4 SBHCs in relation to transportation and proximity to other HHS clinics, as these factors will help us to determine what SBHC is the greatest need, as well as the one that's most suitable of a site to pilot the extended hours program. Piloting the evening hour and weekend program would increase access and education for the entire community, not just for the high school students. Thank you.